Hi, my name is Dr. Narayanankutty Warrier. I am the medical director and senior consultant medical oncology, MVR Cancer Center and Research Institute, Kerala. May 31st, as all of you know, being celebrated as World No Tobacco Day by WHO. In India, at least 30% of our population are commonly using tobacco products. It's a large number, and but luckily we are seeing a trend which is towards decline in the tobacco usage for the last couple of years. Most importantly, our student population or the adolescent population at the age of 9 to 14 are more and more coming into the habit of this tobacco usage, and whatever the intervention we need to do should be targeting this population. But even then, even that itself, the global survey on tobacco products, world survey, World Tobacco Survey itself is showing that there is a negative trend towards that population using tobacco products. So we have every reason to celebrate, but we shouldn't be relaxing. So this kind of awareness programs should be continuously going to the public, so that the awareness will be maintained at a high threshold throughout our country. If you look at each state using tobacco, you can see the Maharashtra leads that in the front. More than 58% of people are using. 58%. The prevalence is 58%. And if you look at the Mizoram, it's again Mizoram is also just behind that, 57%. I'm from Kerala and I have every reason to smile because the tobacco usage in Kerala is the lowest in the country. So it's about 16%. So that is something very encouraging for us. People like me have fought against tobacco for the last 20 years, more than 20 years. And I represent an organization called 𝗔𝗚𝗔𝗜𝗓𝗧𝗜𝗢. 𝗔𝗚𝗔𝗓𝗧 is formed by cancer survivors, and this organization is working on creating awareness among the public for against tobacco. So in 2012, we have started a very large, huge campaign of getting signature from various people against tobacco products, and as a result, many organizations have joined 𝗔𝗚𝗔𝗓𝗧 in the fight against tobacco, and we could succeed. And the government of Kerala in 2012 came out with a landmark bill on tobacco products, and that's how the tobacco products were banned in Kerala. At the same time, this is a public menace. Actually, I don't think that anybody is using tobacco without knowing its bad effects. Now, whoever is using tobacco, they know very well that this causes cancer. This causes empty number of health hazards, but still they are using it because of the various reasons. Our films, our movies, and our web series and the OTT platforms contribute, motivate, or in one way or other, they motivate people to start using tobacco. And now we have started a campaign in Kerala against these sort of reactions. So we are facing a lot of challenges from the film world and the other people who are working in this area. The argument is showing smoking in movies will not motivate anyone to take up smoking. But there are studies not from India but from abroad have shown clearly that 40% of our adolescents start smoking after seeing these kind of scenes in from the movies. So we have a wide we have so many areas still there is a gap, especially situations like the scenes like the movies showing more and more movies showing too much importance to smoking, and that can directly influence our children. So we need to create awareness. I feel that this is the area where we should work. And now there's a large number of population who are in the habit of using tobacco, want to avoid smoking, or they want to quit smoking. So how will you advise them? Is there any way that you can advise them properly? Yes, we have every hospital in our country, at least where there is a pulmonologist working, where there is a social psychology department is working, or where there is a social worker is there, especially the hospitals like FBR Cancer Center, where we have these three departments working together and helping our patients to quit smoking. So what are the ways you can advise them? The first and foremost thing is to make them to create a wish in their mind to stop using this or giving up tobacco in their life. So for that, you have to motivate the family, motivate the person who is in the habit of using tobacco, and then once they are coming forward, especially this is the right time to talk to them regarding the tobacco or the bad effects of tobacco, and about stop using tobacco is when somebody else, some of the relatives have got any health problem, and they have accompanied these relatives to the hospital. So the moment you see any of the attendees of your patients, or somebody who is accompanying a patient, spouse or some other person with tobacco, with the habit of using tobacco, please advise them or please motivate them. Please send them to the psychologist in your the hospital to motivate them to stop smoking. That is one way. And the second way, there are certain products like the chewing gums and the chewable things to help these people tide over the withdrawal symptoms. And also there are psychological counseling possible to tell them that this tobacco, whenever they are stressed after stopping smoking or using tobacco, so the proper an organized counseling will help them to come out of this habit, especially the stress related thing. The first 2 weeks are the most crucial thing. Then once you have succeeded in overcoming these 2 weeks, then the 50% of the work is done. Then subsequently then the difficult task is to avoid the situations where they used to smoke, like when they are going to the toilet, if they are in the habit of using cigarettes in the toilet, then how to avoid such situations. They can even chew some small something just to get over that feel of fear, or get over that feel of using tobacco products in the toilet. And then there are situations where they immediately after coming to the office, they want to just start the day by starting with a cigarette. So they can avoid such scenarios by arranging some meetings immediately, or some some other, they can drink tea or coffee to start with their day in the office. So try to find out the timing of these smoking, that reminds you to go back to the smoking habit in your day-to-day life, and then try to avoid such things after you have decided to quit smoking. And the third thing is, of course, start telling, or uh, become a activist against tobacco, and start telling all other people that about the bad effects of smoking or tobacco usage, and advise people to stop smoking, or encourage them to stop smoking. So these are the three methods. The first and foremost is to have a very strong will or strong wish to stop smoking. Then the second thing is to avoid the situations where you are tempted to smoke or using tobacco products. And third thing is to become a proponent of anti-tobacco. So these are some of the ways you can stop smoking. So the biggest message I want to give to the public is tobacco is a silent killer, and once you are in the habit of smoking or the using tobacco, your health is at very high risk, especially cancers. And tobacco causes more than 30% of all cancers. Need not be the lung alone. Any part of the body is not exempted from the bad effects of tobacco. And in the if you avoid the smoking, then half of your risk for developing cancer is gone. So wishing you all good luck. The most and foremost, and the most important message is prevent our children from getting the habit of tobacco usage. Good luck.